So today we will study the link between conscientiousness and mental disorders. Conscientiousness reflects the tendency to be self-disciplined and organized. It is often described as thoughtful control. The two aspects of conscientiousness are, first, industriousness, which is the ability to work hard and avoid distractions, and second, orderliness, which involves the ability to be neat, punctual, and concerned with details and rules. Both are crucial in the process of determining which goals should be followed. According to the cybernetic Big Five theory, the function of industriousness is to prioritize non-immediate goals, whereas that of orderliness is to follow rules set by others or by oneself. Both functions require selecting and following through with strategies that are not merely responsive to the immediate rewarding or threatening properties of the situation, but rather which take more elaborate and abstract goals. In relation to psychopathology, low conscientiousness is most specifically associated with risk factor disinhibited externalizing problems like impulsivity, substance abuse, criminal behavior, and ADHD. The problems appear to primarily be associated with low industriousness, suggesting a tendency to prioritize immediate goals that interfere with long-term goals. In contrast, orderliness associated with problems linked to compulsivity such as rigid perfectionism and OCPD. Low conscientiousness is a fairly general risk factor for psychopathology, which is consistent with the definition of psychopathology, given that prioritizing goals and sequencing action correctly is crucial for the accomplishment of all but the simplest goals. Evidence for the neural substrates of conscientiousness is sparse. Most clearly implicated is the lateral prefrontal cortex. A number of studies have reported associations between conscientiousness and volume of regions in dorsolateral prefrontal cortex, which is in keeping with this region's role in forming complex goals and plans. Conscientiousness is not associated with working memory ability, however, which is the function most commonly attributed to dorsolateral prefrontal cortex and to the large cognitive control network, which dorsolateral prefrontal cortex is a key node.